Okay, so the next section is going to talk about ischemic heart disease, which also is an acquired heart disease, but there's a little bit more to it, so we're going to have a separate section. We're talking about heart attack or angina. So myocardial infarction is rare in women of childbearing age, but it does happen sometimes. It's ischemia of the heart muscle that's caused by an embolism or a spasm of a coronary artery. Remember, the coronary arteries are the ones that actually feed the heart muscle. So if something blocks one of those, either a clot or a spasm, that part of the heart muscle does not get blood flow. If it doesn't get blood flow temporarily, it's ischemia. If it goes too long without blood flow, it's necrosis. We actually lose part of that heart muscle. We manage a heart attack in pregnant women exactly the same way as every other non-pregnant patient, because the first priority is to take care of the patient in front of you. So morphine, nitrates, lidocaine for arrhythmias, beta blockers, aspirin. Okay, we give the same treatment to those patients that they're going to get to other, they're going to get if they're not pregnant. Magnesium sulfate might be used, or calcium antagonist might be used actually to vasodilate. Thrombolytics don't seem to cross the placenta. One thing that we don't want to do, sometimes for MI, we see it more often for stroke, they give TPA to break down the clot. If they do that in pregnancy, it doesn't cross the placenta, but there's a massive risk of hemorrhage because the placenta is a big vascular organ and the attachment is a little bit tenuous. So there's too big a risk of hemorrhage, so they don't give TPA in pregnancy. Managing labor, a vaginal birth is preferred if someone who's having a heart attack or who has ischemic heart disease or has at risk for heart attack. Vaginal birth is preferred in a side-lying position. We want good pain control. We don't want tachycardia. We don't want to stress the heart. We don't want them pushing. We don't want them to Valsalva because that can trigger an arrhythmia. So we want to assist that birth. So again, heavy epidural, side-lying, forceps or vacuum, no pushing. Okay, the next section is going to be a little bit longer because it's a lot of different cardiovascular or cardiac conditions that can affect labor.